Hey, good morning, everybody. This is Brittany Jennings coming to you live from Seniors Blue Book. And this morning, I'm joined by Dr. Boyette of Coastal Orthopedics. Good morning, Dr. Boyette.
Good morning.
How are you today?
I'm doing fine.
Good. I want to thank you so much for joining us today. As you can see, my background, it's Halloween week. And so we are bringing some wonderful educations and interviews this week. And, there is a joke that I do want to tell, if that's okay with you.
Sure.
What kind of pants do ghosts wear? Boo jeans. So, Dr. Boyette, again, thank you so much for being here. Let's jump into a little introduction for yourself. Tell us a little bit about yourself, how long you've been with Coastal, and a little bit diving into your specialty, common diagnosis that you treat.
Okay, well, I started with Coastal probably just over 8 years ago. Originally grew up just north of here in the Riverview, Brandon area, so not too far away. With my training, I started my undergraduate degree at University of Florida and then went to Tampa, University of South Florida for my medical school, and then went on to do my orthopedics in Orlando. I actually did my hand specialty with my fellowship training up in New York and Syracuse at SUNY Upstate. So I've been a little bit of everywhere. But like I said, I've been here for the last just over 8 years, focusing more so on hand and wrist up to the elbow. But occasionally when we're on trauma call, we do a little bit of everything.
Awesome. Well, with the COVID pandemic and everything happening, a lot of people, including myself, we've kind of shifted from working out in offices or just kind of being out and about to working from home. So people working from their dining rooms, I've actually makeshifted about 4 different places in my home. But have you seen an increase in work-related injuries?
Some work related, some not work related, but overuse, a lot of it being either people on the computer a lot more, whether it's work or not, but also home projects. So people that decided they're going to go ahead and start repainting rooms or modeling parts of their houses. So a lot of overuse I've seen, whether it's on the keyboard or not over the last few months with COVID.
That's what I was going to say too, is I know for, again, just one of those examples perfectly is my posture and your neck, your back. I mean, there's a lot of different things, of course, again, making sure that you've got the right, angle with your computer, your laptop. So what are some of those more specific injuries that you've been seeing at home from people working with the computer? Is it like the carpal tunnel, or what types of things?
Yeah, typically it's carpal tunnel is what we're seeing most commonly. And a lot of it's, like you said, it's posture, it's how your wrist and your elbows align. They have a lot of ergonomic type keyboards, and not only the keyboarding, but sometimes just using the mouse and the way your wrist is positioned. And the most important thing is just to make sure your forearm and wrist, everything's positioned neutral. If in a straight line, if you're seat is too low, your desk is too high, all of a sudden your wrist is in kind of an awkward position, and it can put a little bit more stress on the nerve at the carpal tunnel. So it's really working on posture, which starts with your neck and back and all the way down to the arm and wrist.
And this is one too that I've experienced, which is weakness or loss of sensation, waking up at night and your hands feel like they've fallen asleep.
Exactly. So with carpal tunnel, a lot of times what you're going to get is the numbness and tingling. And typically it can affect all of the fingers except the pinky. The pinky or the small finger should not be involved. Although when you feel like your hand's falling asleep, some people can't differentiate whether it's 4 fingers or 5 fingers. It just feels like the hand falling asleep. A lot of people have the tendency to want to shake out their hand when it's falling asleep. It can wake you up from sleep with the numbness being very uncomfortable. Usually if that happens, one of the first things we recommend is just wearing a wrist brace at night, and that can reposition the wrist in a more comfortable position. And that can help in some cases.
What are some of the other treatment options or common procedures to treat carpal tunnel?
So typically, if it's early on, just mild, we'll start with trying to figure out what caused it. And, depending on what it is, modifying how you're doing it. For example, we talked about if you're on the computer, trying to figure out more ergonomic ways to reposition your wrist. If it's being out in the yard, doing any yard projects or a lot of gripping and things like that, pulling weeds, taking more frequent breaks. Anti-inflammatories can help if we think it's related to just overuse and inflammation. It doesn't help all the time. The bracing, we talked about wearing braces, particularly at night. There's some stretching exercise or nerve glide exercises that you can do as well. And eventually, depending on how significant it is, we'll start talking about therapy or even cortisone injection or surgery.
And with the surgery, is that an outpatient procedure or how does that work?
Surgery is an outpatient procedure. It's a fairly quick procedure, but it is done at a surgery center. And there's a couple ways to do the surgery. You know, with carpal tunnel, you have literally a tunnel. Part of it's made up by the wrist bones in your hand, and the other part's just a little covering or a ligament. And that space is just too tight for the nerve, and that's when the nerve starts to get compressed. So what we do with the carpal tunnel is we release or just make a little incision on the ligament to open up the space, give the nerve more room. And there's two ways that I do to approach it. One is just a standard little incision directly over the ligament to open it up. And there's also a little bit of a less invasive technique which is an endoscopic carpal tunnel release, where we can make a smaller incision in the wrist and go in with a camera, and that camera can actually release the ligament for us with a little blade.
And everybody, I'm sure, is a little bit different depending on their age, depending on the severity. But what would you say the expected or average recovery time would be from a surgery like that?
You're absolutely right. With carpal tunnel, everybody is different. And I think what your pre-activity level is kind of determines how quickly you're going to get back to it. People that use their hands a lot require a lot of strength out of their hands. For example, mechanics tend to take a little bit longer to get to where they need to be because they notice, you know, that loss of strength or that discomfort more than somebody who is just basically mostly sedentary keyboarding, where you're not using a lot of strength in your hands and just movement. Movement is typically fine to do within a day or so after surgery. I'll let you start moving your fingers right away. It's more the heavy lifting, pushing, pulling where I put the restriction on. So by 6 weeks, even though you may still have some tenderness in the scar, typically you're probably doing the majority of what you were doing before. Some people, you know, at 2 weeks are doing 80% of what they were doing before, depending on what it was they were doing. One of the things you can find with carpal tunnel is the incisions in an uncomfortable place. It's in the palm of your hand. So with either surgery, it's not uncommon for people to have some tenderness right there in the palm of their hand for up to 3 to 4 months. More so a reminder, like if you're using your palms to lift you out of a chair or anything like that. But typically doesn't get in your way. You're still very functional much sooner than that. By 2 weeks, like I said, you're doing most of your basic activities.
So we've kind of covered some different suggestions, of course, through our conversation, but can you kind of go back through and let's recap suggestions that you would have for people to avoid these types of injuries?
Sure. So if we go back to, we were talking about more when we're keyboarding or on the computer a lot, posturing and positioning, keeping your elbows close to your body and making sure that your forearm, wrist are all aligned in a straight line where you're not either bending your wrist too much in either direction. When you're using a mouse, they have different types of mouse that may hold your wrist in a better position where it's more comfortable. But also you don't want to grip the mouse too tightly. That can also aggravate the carpal tunnel. Making sure that the keyboard is at an appropriate height. We talked about if your desk is not at the appropriate level for your chair, you'll find the keyboard being too high or too low, and that can force your wrist to bend as well. Also, having, going back to just your posture in general, making sure that there's a good lumbar support for your chair. To kind of help with your posture, your back and your neck. And that can also contribute to some fatigue and also affect your carpal tunnel as well. And then most importantly, if you're starting to have any symptoms, take regular breaks. A lot of it is not just the positioning, but it's overuse. So if you feel that you're starting to get any of the symptoms, take a break, 5-10 minutes, just walk away, and then start all over again once it feels better.
I already find myself like readjusting as you were talking. I'm like thinking, is my keyboard set at the right height? Like, is everything, kind of,
right.
those are great tips that we, if you're aware of them to be able to practice those. Again, especially for somebody working from home you know, 6 to 12 hours a day on the computer, as a lot of us have, and people at home, like you said, even people that are not working, just people that are doing different things at home that they weren't necessarily doing before, to be aware of this.
Right. Yeah.
Well, I want to thank you so much for being here today with Seniors Blue Book Live. Dr. Boyette at Coastal Orthopedics. I will put all the information for Coastal in the post. And again, thank you so much for sharing all this information about your specialty out there.
Thank you so much for having me. I appreciate it.
All right, everybody, thanks for tuning in, and look for our next Seniors Blue Book Live, and have a wonderful day.